I'd come across a book by Gray Cook and Functional Movement Systems called The Movement Book. And there's a diagnostic tool called the Selective Functional Movement Assessment that really piqued my interest. You know, one thing that appealed to me about the Selective Functional Movement Assessment is, one, it doesn't just focus on where your pain is. One, it actually catalogs your movement. And two, it helps you dial in to where the problem segments are, and it helps prioritize, you know, the order in which they should be treated. Which it seemed like a very just, you know, I'm a software engineer, so the logic of it, you know, just really appealed to me.
The clinical framework that we use at Mountain River Physical Therapy is patient-centered. The bedrock of that is functional movement systems, and that we set up a feedback loop that improves communication and accountability between the practitioner and the client. And in that way, we're able to test and intervene and retest. We're not focused just on the method or the modality that we use to treat pain or movement dysfunction, but we're looking at the entire person in a holistic perspective. And then we put the best approach of manual therapy and exercise together to change that movement baseline.
Well, number one, Dr. Reagan and his staff, I've never had anyone spend this much time with me. Watching Dr. Reagan and his staff use the Selective Functional Movement Assessment, like, you really see the courage it takes to use it. Because when you set up this objective test and say, all right, Steve, like, you know, your active straight leg raise, whatever the test is, like, you know, you're failing it, I'm gonna try a modality, and it doesn't work. And, you know, that takes courage. It's not like, hey, it looks better to me. No, it's like, no, that didn't fix it. Like, let's try something else. I think it takes a lot of courage, and it's really cool to see someone not afraid of that. It kind of gave me some peace about where my body is, what it's capable of, quieted some of the, you know, the searching, because, you know, Dr. Reagan said he sees some people like me that try all these things, and something about this experience, you know, the stuff I learned from it, I'm going to carry it with me the rest of my life.